Hey everyone, I'm Tammy Davis and I really thank you for joining me today. I wanted to kind of go into a little bit about nutraceuticals, um, primarily because I think we're overdoing it. I mean, there is such a thing considered to be megadosing, and I believe from what I was told from a couple of my clients that relocated outside of California have said that it is actually against the law now, or the people are cracking down on megadosing, which I'm really delighted to hear. But it's concerning, especially with the rise of direct marketing companies that are selling all levels of supplements. Now, when I talk about supplements, I'm not necessarily in this case referring to things like vitamins and minerals and just your basics like we see, B complex, multis. I'm talking about the ones that have like a series of numbers and letters, and they sound, the way they're presented, they seem very therapeutic. And again, this goes into, pardon me, but this goes into a lot with the nutraceutical companies that are along the lines of being more direct marketing. Although I have seen a number of, and I am actually familiar with a particular nutraceutical company that I almost went into contract with, but I opted not to. Primarily, they wanted me to actually create specialized formulas for the MTHFR, the methylation pathway, the various genetic defects of the MTHFR gene, and the subsequent other issues, CBS, nitric oxide synthase. I mean, I can get into all of it, but again, these are things that a lot of naturopaths are doing, and people are talking about in chiropractors, and I mean, even general practitioners are talking about the methylation pathway. Go get your DNA tested, saliva test, and we'll test and see what genetic, again, defects you have. And I was involved with an office at that point in time when a nutraceutical company approached me about doing very specific oil blends for these various genetic defects. And if you've not watched any of my videos before, you will then I will just tell you right here and right now, I do not believe in genetic defects. There was a point when I first was introduced to all of that I was like, oh yeah, there's something wrong, but no, there's nothing wrong. The body adapts, and these genetic adaptations are of value. There's a purpose behind it, and that is part of the reason why I've started the Patreon site, is because I'm trying to help people. Well, they say people don't want to be helped. People aren't looking to be helped. So I'm trying to teach people how to redirect their mindset in order to realize that the body is actually functioning. So I opted out of that contract because truthfully, I don't believe in one size fits all. In fact, I've come to discover professionally that one size does not fit all. And, one of the things that comes to mind as I say that, and it brings me to the reason for even doing this video about nutraceuticals, is pharmaceuticals themselves are designed to control certain activities within the body, whether it be to inactivate a genetic receptor, activate it, adjust the way a liver enzyme is functioning in order to maintain blood serum levels of the medication. I mean, there's a very, truthfully, the intelligence that goes into designing these medications is absolutely fascinating. I'm not going to lie. I think it's incredible what we can actually do with medications. But that said, one of the things that they also say is, even though they know, because medication could be affecting just one genetic receptor, it could be as I've seen as many as 25 at one time, and that does not include liver enzymes. At the same time, they're also very well aware that full systemic effects, the physiological effects throughout the system, are unknown. So even though they know what they're doing to a certain degree, they have no idea how it's going to affect any individual ultimately. And that's the scary part. And this is where I come in. And again, this is another reason why I started the Patreon site, is because I want to help people understand how to create a stability. Because if we have to take these medications, then those unknown physiological effects can be stabilized with very specific oils. And again, it's not like there's a handful of oils that you can use that are going to work for anyone or everybody. That's the reason why I didn't go into contract with this particular nutraceutical company. And no, it wasn't direct marketing. It was actually, they sell primarily to they told me that they sold directly to health professionals, where the bottles are sold out of a clinic or an office. But the fact is, I've actually seen them in little store shops along the country roads of Pennsylvania. So I don't know about that. At any rate, it doesn't make any difference, truthfully. Um, but the point is that these nutraceutical companies are often, they're not unlike pharmaceutical companies. And the challenge that I have with them is, I mean, and if I'm going to weigh it out, I mean, at least in medication, you have to use caution. We know that. When you're starting in any sort of psychotropic medication, they will step you up. And if you're going to come off of it, they will step you down because of the impact that it has on the system, and you have to take it your time. With these nutraceuticals, it's just anything's fair game. I mean, if you actually look at some of these labels, it's insane the number of ingredients that are in these products. It's just absolutely insane. And then you have registered or trademark. It's actually registered formulas, proprietary blends that are considered registered, and you have to dig. I mean, it takes a lot of work to kind of decipher everything that's in it, and that's if you can, because some of these are trade recipes. And but the point that I'm getting at is that at least with the pharmaceutical, there's some guidance on how to use it. There's some caution on how to implement and come off of them. But with the nutraceuticals, like I said, we're looking at it, oh, that's just a nutritional supplement, so we can just take as much as we want, or and so we're like seriously overdosing on supplements. And some of you may say, well, that's not a problem. Well, let me just remind you that some vitamins and minerals are considered fat soluble, which means they are transported into the body through fat, and they are stored in fat. Whatever you don't use becomes stored in the fat tissue. So there's a point of getting toxicity levels, and I find it fascinating that so many people are wanting to detox and feeling like there's just so many toxins in the environment, when in fact we're overdosing on fat-soluble vitamins and minerals and God knows what other nutrients are in these things. Again, it's crazy. I mean, it's absolutely insane. It's not crazy. It's insane to see the level of ingredients that are being placed into these supplements. And the challenge that I've also had with that is that the people selling it, whether it be in a store or in a downline for a company, is that they don't understand the product. Because let me just say this much. Well, there's a couple of things. A lot of these nutraceutical companies are headed by bioengineers. Some of these bioengineers, and I can think of one company in particular, actually came from the pharmaceutical industry. They're no different. These nutraceutical companies are essentially owned and operated, or their umbrella company happens to be in the pharmaceutical industry. So this is bioengineers that are heading these things up. And for as much as they are mass producing, and I've said this in other videos, and I will continue to say it, I do understand why we have medications. They are studying plant constituents when it comes to drug development. This is actually where I come in. I have a background in pharmacology. I'm a phytotherapist and an aromacologist that actually continues to study plant constituents and the mechanism of action on the human genome as it relates to drug development and human health. And that's a lot to say right there, but that's actually what I pay attention to, because I want people to feel well. But if we're just taking so much crap and we don't understand what it's doing, and we really don't even get what's in it, because all we're doing is reading literature, or we're talking to our upline and those who want to take us into rallies and really pump us up and encourage us to sell, we're not really, and we're told it's healthy. We want to believe these people. Look, I get it. I mean, who wants to sit back at a table and go, you're lying? That's just total BS. You don't know what you're talking about. I mean, we don't do that. We're excited about making money. We're excited about helping people. So it all makes a lot of sense. And yet we've got to begin to use some caution. The first thing that comes to mind right now, honestly, is a woman that I've started working with just recently, 52 years of age, was originally told she had MS. Now they've kind of disqualified or just said, no, not MS, but Lyme and heavy metals. The challenge is that for the last 7 years, that would be since she was 45 years of age, she's been in a wheelchair to the point where she cannot walk. The spasticity in her legs is so severe, she has absolutely no use of her legs, and she has absolutely no use of her hands. She started out in conventional medicine, or she just started out in the medical world, and when she wasn't getting results there, she decided to go natural. But unfortunately, the natural solutions that she's trying are crazy amounts of, nope, insane amounts of nutrients. They are so mega dosing her. I've actually had to count, for instance, the amount of L-carnitine, the milligrams of L-carnitine that she's taking. Because L-carnitine, high levels of L-carnitine can actually cause seizures, lead to seizures. And what my concern is, truthfully, is that her spasticity is very, it's not unlike a seizure, even though it's not a in the head kind of, and she's not tripping out, but it's her body seizing up. So these are the kinds of things that I'm talking about. We don't need to be megadosing. I mean, this woman spends $1,500 a month in supplements, and she's not getting any better. Yet all of these companies, or these two particular, well, I should say there's one company involved, and then there's another wellness center that's involved. Actually their recommendations aren't nearly as nuts as this other company. But again, I'm very, very concerned about the way people are selling these things. And again, I feel like I'm repeating myself, so just bear with me here, because I don't mean any disrespect. And like I said, I do understand the excitement over making money, the excitement over helping people, the excitement about being healthy. And of course, this material and what we're being told about these products sounds phenomenal. And yet there is no point to it. I mean, I think the theory is, from what I understand, the theory is that if you push a lot of nutrients into the body, you can actually override some of these genetic defects. But the truth is you can't. You might do some benefit. I'm not saying there's absolutely no benefit to taking it, but truthfully, you don't need to take as much. And what's even worse is a lot of these products are being produced with what's considered a delivery mechanism, where there's actually, it's either nanotechnology or there's some sort of emulsion that actually helps. It's the delivery process, so it actually increases the assimilation rate. Again, the whole thought process is that we can override some of these genetic defects, but we can't, because we're not actually looking at the deeper picture or the bigger picture. Like when I look at a medication, for instance, I look at when somebody comes to me and they're taking medications, I actually go into, I mean, you can kind of, I mean, I've gotten to know the medications fairly well, but you still, with all the information that I have in my head, and after 30 years, it's like actually longer than 30 years now, it's hard to maintain everything in your head. So I always double check everything. And the truth is that when I look at these medications and I see what they're targeting, I want to remind you of one thing. When we attempt to control or force something, it's always harmful. You know, if you really try to exert force, the potential for breaking something and causing harm is there. Whether it be, you know, an inanimate object, like, or try to force somebody to do something they don't want to do. You try to control somebody when in fact they don't want to do what you're asking them to do, but you're, exerting some degree of control over them. We all know how that goes. The body isn't any different. So this is, again, the reason why I've started the Patreon group, and in part is because I'm a big advocate for the consistent use of essential oils. However, they do need to be changed out from time to time, because they are chemicals, just like our medications, just like the foods, just like everything around us, because nature communicates via chemicals. So you're adjusting the chemistry. So changing them out and being mindful of what's being used. If that includes medications, then therefore you have to understand what the target is, very specifically what the target is. And then you incorporate oils that actually assist with the stabilization. Now, the other thing about the oils is they have the ability to improve assimilation. We don't have need for all of this technology. It's already built into nature. And so the thing is with the oils, they provide stability, they relieve stress at the cellular level, at which point now the body will actually make new adjustments. So let's just say our genes are chronically engaged in a stress response, and the stress response was activated based on what we were exposed to. But then we start to relieve that pressure at the cellular level. And I'm not just talking about mental emotion, I'm talking about the cellular level. And there's not many things that can do that, but the oils can. They do, so they do create, and they do actually have the ability to activate and deactivate. They do influence CYP450 enzyme activity, which is your liver enzymes. So again, knowing, number one, how that all interacts and not duplicating the mechanism of action is an important one. But when we don't duplicate, we create stability. We are mindful of to eliminate any potential interactions in the liver. The next thing is that the stress begins to come down at the cellular level, at which point the body begins to deactivate the stress response, meaning it's making adjustments to its chemistry. And when it does that, it's sending different signals, and the nutrient load is different. The nutrient requirements are different. Somebody once said to me, I was listening to somebody actually who was teaching Nutraceuticals, which is, again, along these lines of how to use nutrition to offset the epigenome, the defects of the epigenome. And I'm sorry I keep doing that, but I'm trying to emphasize the fact that they're really not defects. The body is actually functional. It's not dysfunctional. And that it's operating in a way that it's wired to based on the information coming in. And so, one of the things that this individual would say is that when they're in the presence of a genetic defect, it uses different nutrients. And it becomes toxic. Well, and then for the longest time, honestly, because I was listening to her, I was following what she was saying. I mean, I was fascinated by what she was saying, but in my mind, there's more. And like I talk about it on the Patreon description, if I had to say anything about my God-given gift, it's actually the ability to follow a mystery, actually pursue the discovery of whatever the mystery is. I mean, I don't know if that I said that right, but it's like I don't just go on this I think the thing what I'm trying to say is that so many people go, when I talk about researching, they go, oh yeah, I research too. And it's not that I don't doubt it. I'm sure many people research, but somehow or another, something doesn't sit right with me. And my mind starts to go over here, and I start to go over here, and I find this information, and it's absolutely fascinating. So in this case of the nutrigenomics, it was something didn't sit right with me. It wasn't like there was, a misuse of nutrients, because I had to find out for myself what is actually going on in the body. Why are we talking about it as being dysfunctional? Why are we seeing such an increase in degenerative disease? And so through asking those types of questions, I came to discover that the body makes adjustments as necessary. And in that process of altering its function, it's using nutrients in a different way. So no manner of nutrigenomics is actually, because let's face it, if it was working, why are people still struggling? Because the fact is all this mega dosing is actually stressing the body even further. My mother-in-law came to me and wanted to take, don't know that I actually want to mention the pill here, but it's becoming an increasingly popular pill in a particular direct marketing company, because it's obviously anti-aging, it helps produce energy, and all of these things. And she wanted to know what I thought, because she's actually using the oils, and I told her she had to use one or the other, but I didn't see using them together, because she's in her upper 70s. I couldn't see stressing her and taxing her system even further, because she's already dealing with some health issues. And I understand her desire to feel well, but the fact is she can't use the two together. They just don't work together, because number one, the oils, like I said, actually help with the assimilation of correct nutrients. But in the meantime, she's wanting to take this pill that's going to mega dose her system. Number one, with niacin, that's a big one. And I realize, that to me is in response a lot to this epigenetic fad that we have. Niacin's a big one. I've seen so many discussions on Facebook about people who are heavily invested in MTHFR issues, or the methylation pathway, and the various new supplements that they're taking in order to override some of these genetic adaptations. So I can see how that particular pill came into existence, because it's an answer. It's supposed to be an answer to some of the breakdown that would occur in the transsulfurization process. So, and CBS, but that's not the television station either. I'm talking about the gene complex. But anyway, that said, so my point to this is that when you join me on Patreon, that we can get into these things, and I can begin to break this information down, or I am breaking this information down. It is a lot of information, but the truth is that I really want to help people. And the first thing we have to do is stop overdoing it in the nutraceutical department. And for people who are trying to sell products, I'm really sorry, because it's not my intention to take anything out of your pocket. But we have to understand that these things don't always work for everyone. And we have to understand that in the case of my client who isn't confined to a wheelchair, the amount of supplements she was taking from one direct company were so full of herbal stimulants and caffeine, it's no wonder she was seized up. And then who's to say with all the L-carnitine that she's taking too? I don't know. But, I think it's time to really rethink the way we are supplementing our bodies. Now, if that's something that you want to do and you're getting benefit out of it, then that's great. This isn't necessarily something that's for everyone, but I'm just putting it out there that sometimes doing too much is too much. And backing off, like I told this particular woman, Lizanne, I said, it's not like you have to quit altogether. You still have them there. You can always go back and take them from time to time. So it's not trying to take away from the company. But I am trying to be adamant about the fact that our health conditions are declining. They're getting worse. They're not getting better. No matter how many miracle supplements we have out there, they're not getting any better. There's a few cases of people seeing improvement, but for overall, they're not. And the nutraceuticals are no different than the pharmaceuticals, where they are, in fact, like I said, in this case of this one particular pill, trying to affect very certain activities within the system. And I think there's other things in there. I know there was besides a trademarked proprietary blend, there was also a number of amino acids. So they're trying to override what's going on in the body, and just pretending as if these genetic adaptations are, we can just be ignored. But the fact is, what's underneath all of that is what's actually causing the genetic adaptations. I do realize, don't get me wrong, when I say that there's no defects, there aren't any defects, they're genetic adaptations. And I do realize that they're leading to health issues. There's no question about it. But the question really underneath that is, what is going on? Because you really think, trying to come up with a great analogy here. But if you think that you can ignore I guess the best example I have is, let's just say you've been outside on a hot day and you've been sweating your ass off, and instead of coming inside because you have to go somewhere and taking a shower, you just dose yourself with some cologne and possibly put on some deodorant, and you just to kind of mask the fact that you're dirty and sweaty and possibly stinky. It's the same thing. When we try to override what we think we're doing, is override these genetic adaptations and fooling the body into picking up these nutrients, we're still not getting to the root of the issue. Just like I've talked about in other videos, to take all the anti-inflammatories, the antioxidants that we can take, doesn't eliminate the fact that oxidative stress continues to be produced. Why is it being produced? It's being produced because the body is being traumatized, especially by the environment. And then you've got all the emotional and mental stuff that's going on. Our bodies are traumatized at this point. And so just trying to take antioxidants and overdose on other nutrients isn't going to eliminate the fact that the body is still traumatized. It's just not going to do it. So as I've said, if these things were actually working, then why aren't we getting better? And why do we have to keep bringing out more and more products? One company one-upping the other one. So if you're involved with these companies, please understand that they are not unlike pharmaceuticals, where they're very specific in their actions. And if people are going to take them, it's always wise to give them less and include essential oils on an ongoing basis. I keep getting asked all the time, how long do I have to take oils? Essential oils are not a medication. I mean, they are in a way, but they're not. They are the reason why we have medications, but they're not a medication. And what I mean by that is, like, if you have, like, say, an infection and you take an antibiotic for so long and then you stop. I see people doing that all the time with oils. Well, I use it for a little while and then I stop. And then a year later, they call me back and they're like, well, I got the problem again. Well, I wonder why. This isn't a hobby for me. This is something that I'm extraordinarily passionate about. This has been my entire life, basically, ever since I was a young girl, heavily devoted to my mystery novels, to beginning my first job was in the pharmaceutical industry. So I've been involved with this my entire life. This has been my trek my entire life. I do not represent a company. So if somebody says to me, well, you're just trying to make money off of me, I do require an income just like everybody else. I have to say that much. And I devote an awful lot of time with a number of clients that I do, private clients that I do have. I devote an awful lot of time and energy into research. And you might be wondering, why do I research so much? Well, because everybody is different. And just because one person takes, and I'm going to use this one off, it just came off the top of my head, Celexa. Just because one person takes Alexa and another person takes Alexa and another person, they all have different things going on, and their way their body is responding is different. As I mentioned to you, the full scope of physiological effects are unknown. So I do research and I look into things and I follow that trail that I mentioned earlier of sleuthing for the answers. And so I devote an awful lot of time and energy in that. And that's actually what's going into the Patreon program. So that's the reason why participation is actually a contribution, because the more questions we get and become engaged, I get engaged in, the more I can support you with information. You may not be may not be looking for help, but are you willing, would you like to learn something new, something that's not being discussed anywhere else? So anyway, that's my point to this. It's my life. It's my life's mission. It's my life's work, and I'm here to teach it. And I'm here to help you gauge. And it's not for everybody. Trust me, I will challenge our current medical model. It's not because I'm against medicine. The two worlds need to come together and work together. But we have to understand how to do it. And what you have is you've got a medical world that is really not happy with the natural world. And you got the natural world that's just coming up against the medical world because they think, whatever they think. I'm not going to get into that part. But I can't blame the medical world for thinking that about the natural world, because we have so much. And it's funny, the nutraceutical companies are no different than the e-cigarette companies. E-cigarette companies are actually owned by the major tobacco industry. It's another avenue, because they know. It's just like Toyota. Toyota has their line of vehicles, and it's to a particular demographic. But then they came out with a different line of vehicles for another demographic because they wanted to be able to reach the entire, as many people in the market as possible. That's what the nutraceutical companies are doing, because they realize many people don't want to do pharmaceuticals, but they will listen to if something is supposed to be nutritional, have nutritional value. And my job, my God-given job, is to actually help people make sense of it all and use it wisely, and so that they get the best results. This isn't about one is better than the other. This is about how to work it together and pay attention and actually teaching you how to do this for yourself. So anyway, I look forward to chatting with you. I hope you will join me on Patreon. It's my life's work. Like I said, this is what gets me out of bed in the morning. It's not a hobby. And I chose Patreon because, as I mentioned also, I do require a reliable income. I need something to come in. It's not like you can go to the store and take something off the shelf and walk out. That's called shoplifting. So all I'm asking you to do is, join me, and at whatever level, and it makes sense to you. By the time I get to 500 patrons or members, then everybody will pay $15 a month and have access to everything, at the same level. So I would hope that you would like to join in and help me share this information. It's cutting edge. It is worthy of teaching to our children. If you really want to know, I have, hold on just a second. Just want to show you something. I don't know if you can see this. All those cards in there, those are all active clients. All active clients. And they keep coming back because we're getting results. I had a young girl who, every time they put her in a hospital for mental and emotional disturbances, she'd run out. They couldn't get her to stay down. They couldn't, and she refused to take the medications. Less than a year later, she's stable, has 2 jobs, and is getting married. These are the kind of successes I have. MS, muscular dystrophy, actually myotonic dystrophy more specifically. So I'm seeing these results, and that accordion file there is all active clients. So I'm just sharing that with you because this does work. And I would love the opportunity to teach you, because the more we can spread the word about how to do this and how to actually help the two, all of it work together, the healthier we're going to be, and the greater chances our kids have of having healthier futures. So anyway, thanks for watching, and please share this video. I'm really, like I said, looking to build this because I would much rather get to 500, sooner than later, because at that point, I think $15 a month is a reasonable rate to get as much information that you're going to get from me. And I only wish that I could convey how much information you're going to get, but it'll be overwhelming. At the same time, it'll also allow me to compile everything and actually turn it into a book possibly someday. Anyway, again, thanks for watching. I look forward to chatting with you. And until then, have an absolutely beautiful day.